This is part 2, and I spent less than 10 minutes treating her. And her body responded very nicely. So now I can rotate the pelvis to a stop point, and then if I add a little bit of thrust, there's a spring forward and a recoil. And that's true on both sides. Can you lie on your stomach now? It's going to be very easy for her to keep this mobility gain. The sacrotuberous ligament is now normal. The sacrospinous ligament now has normal spring mobility. I can load the lower sacrum. I can spring it, and it springs and it recoils. And this inferior glide, I can now load that and I can spring it. Testing L5, I can now load that and spring it. And put your arms on your sides, please. And I checked the upper back a while ago. Good, good, good. And lie on your back, please. Okay, and she now has good lateral play in the first vertebrae, the atlas. And if I test traction, I can take up the slack and I can spring it. And now I put her head in some extension, her neck, and again, I can traction it to a stop point and then I can spring it. So reflexively, these two parts of her body normalized when we restored normal mobility in the pelvis. Okay? A lot of controversy with the sacroiliac joint, but it does have a little bit of micromotion, but it's certainly influenced by the rest of the system. Can you sit up and you can face the window and tell us how you responded to treatment?
So first, what do you want to know exactly?
Oh, so after I finished treating you,
yeah.
You walked and then you sat in the chair.
Yeah, so the first time there was one leg still that felt heavier than the other one.
Okay.
But the sitting and standing was not painful, and then you made another adjustment and the walking was balanced.
Very good.
Sitting and standing, no problem.
Nice. And before that, you hurt when you went from sitting to
yes.
standing, and you had to modify how you sit.
Mm-hmm.
So, you know, your body is very young and healthy, and musculoskeletal system is, you know, excellent mobility in your hips and feet and ankles. And you responded really readily to my treatment. So it's going to be very easy for you to keep this motion. And now when you do normal activities, walking, sitting, sit to stand, all of that stuff, wherever the motion was restricted prior, it's no longer restricted. So the body will find that motion each time automatically. Okay. I will see you again tomorrow. I'll retest everything, and I'll teach you some real simple things that you'll do once a week just to make sure that you keep the mobility.
Yeah.
But anyway, I'm pleased with the gains and look forward to seeing you tomorrow. Thank you.